Hello everyone, welcome back. This is part 5 of our muscles of lower limb series. In today's video, we'll discuss the muscles of medial compartment of the thigh. The medial compartment consists of 6 muscles, the obturator externus, pectineus, gracilis, and the 3 adductor muscles, that is adductor brevis, adductor longus, and adductor magnus. We will discuss each of these muscles in detail, including their virgin insertion, nerve supply, and actions and all. I'll share some important points and easy tips to remember them at the end of the video. So make sure to watch the video till the end. So let's get started. First muscle is obturator externus. Obturator externus origin. It arises from the anterior surface of the obturator membrane and the bony margins of the obturator foramen. So the name itself gives a clue. Obturator externus originates from the obturator membrane and obturator foramen, making it easier to remember. Okay. Then insertion. It inserts into the trochanteric fossa of the femur. And actions at the hip joint. It performs external rotation of the thigh. It also assists in abduction of the thigh when the hip is flexed, and it helps to stabilize the head of the femur within the acetabulum. So innervation, it's supplied by the obturator nerve with a nerve root from L3 and L4. So blood supply is provided by the obturator artery and the medial circumflex femoral artery. And important note is, you may have heard about the obturator internus muscle in the previous video. So don't get confused between the two. The obturator internus is one of the deep gluteal muscle, whereas the obturator externus belongs to this medial compartment of the thigh. Okay, so don't get confused there. Understand this. Second one is pectineus muscle. The pectineus originates from the superior pubic ramus, especially from the pectineal line of the pubis. So this is easy to way to remember because the muscle name and its origin both contain the word pectineal. Okay, then insertion, it inserts in the pectineal line of the femur. So simple memory tip is pectineal line of the pubis to the pectineal line of the femur. So remember original insertion point by pectineal word. Okay, then action at the hip joint, the pectineus helps in thigh flexion, thigh adduction, and thigh external rotation. Then it may also assist internal rotation depending on the position of the hip and contributes to pelvic stabilization during movement. Then innervation, that is nerve supply. This is primarily supplied by the femoral nerve, but may also resist branches of the obturator nerve. Then blood supply is supplied by the medial circumflex femoral artery and obturator artery. Third muscle is gracilis muscle. It originates from the inferior pubic ramus and the anterior body of the pubis, and insertion is onto the medial surface of the proximal tibia through the pes anserinus tendon. Okay, then action is at the hip joint. It helps in thigh flexion and thigh adduction. For the knee joint, it assists in leg flexion and internal rotation of the leg. And innervation, the gracilis is supplied by the obturator nerve. Okay, and blood supply, it receives blood from branches of the deep femoral artery, that is profunda femoris artery. And gracilis is the only adductor muscle that crosses both the hip joint and the knee joint, because it crosses the knee. In the insertion point, you can see it inserted to the proximal tibia. So it crosses the knee and it can help in leg flexion and internal rotation. Okay. Next is the adductor muscles of the thigh. There are three main adductor muscles: the adductor brevis, adductor longus, and adductor magnus. So now adductor brevis is origin. The adductor brevis originates from the anterior surface of the body of the pubis and the inferior pubic ramus and inserts into the linea aspera of the femur. Okay, then action at the hip joint, the adductor brevis helps in thigh adduction. It's a primary action. Okay, then thigh flexion, thigh external rotation, and the pelvic stabilization. So simple tip is, the name itself gives away its function, right? That is adductor brevis, that is adduction of the thigh. Remember the function by its name. And innervation is supplied by the obturator nerve, and blood supply is comes mainly from the deep femoral artery, that is arteria profunda femoris. Next adductor muscle is adductor longus. originates from the body of the pubis, just inferior to the pubic crest and lateral to the pubic symphysis. Okay, then insertion, it inserts to the linea aspera of the femur. Remember, middle third of the linea aspera of the femur. Then now supply, adductor longus supplied by the obturator nerve. Then blood supply is deep femoral artery and the obturator artery. Functions, at the hip joint, the adductor longus adducts the thigh. Again, the name in the name itself, adductor longus, that is adduction of the thigh, is a primary action, and assist in flexion of the thigh and also lateral rotation of the thigh and helps to stabilize the pelvis. Next one is adductor magnus muscle. It is the largest muscle of the medial compartment of the thigh. Okay, consists of two parts, that is adductor part and hamstring part. It's also called as ischocondylar part. So origin, adductor part originates from the inferior pubic ramus and ramus of the ischium, whereas hamstring part, that is ischocondylar part, is originates from the ischial tuberosity. And insertion, adductor part is inserted to the linea aspera of the femur, whereas hamstring part is inserted to the adductor tubercle of the femur. So remember that there is adductor tubercle is a special bony prominence on the femur, where the hamstring part of the adductor magnus inserts. Okay, and now supply, adductor part is by obturator nerve, whereas hamstring part is by tibial division of the sciatic nerve. So blood supply is by deep femoral artery and femoral artery. So functions, that's actions of this muscle is, adductor part is again adduction of the thigh and assist in flexion of the thigh and also assist in lateral rotation of the thigh, whereas hamstring part is extension of the thigh and assist in medial rotation of the thigh. So entire muscle just stabilize the pelvis during daily activities. So remember, adductor magnus has a muscle with the two personalities, one is adductor part and hamstring part. Now let us move on the most important part of our video, the note point. These simple memory tips will help you remember the muscles of the medial compartment of the thigh more easily. Okay. The first point is pectineus muscle. The pectineus muscle originates from the pectineal line of the pubis and inserts into the pectineal line of the femur. You know that. So the easy trick is remember the word pectineal. Pectineal line of the pubis is origin, pectineal line of the femur is the insertion. Okay, remember word pectineal in the muscle name, so pectineus, remember pectineal. Next, second point is adductor brevis and adductor longus. The name themselves helps you remember. Brevis means short muscle and longus means long muscle. So therefore adductor brevis is the shorter muscle of the thigh, of the medial compartment, and adductor longus is the longer muscle of the medial compartment of the thigh. And very important point is adductor muscles. Okay, it inserts into the linea aspera of the femur, which includes adductor brevis, adductor longus, adductor magnus and adductor minimus. So whenever you think the adductor muscle, remember adductors love the linea aspera. Remember this line, adductors love the linea aspera. This is help you recall the insertion quickly during the examination. So these all muscle get inserted to the linea aspera of the femoris. Next is gracilis, the exception. The gracilis muscle is an exception in the medial compartment. Most muscles of this compartment inserts into the femur, but gracilis inserts into the medial surface of the tibia as a part of pes anserinus. So remember, gracilis goes to the tibia. Next is adductor muscles. The main adductor muscles are adductor brevis, adductor longus and adductor magnus. There is also a small muscle called as adductor minimus, which is often considered as a part of adductor magnus. Okay, so it originates from the inferior pubic ramus and inserts to the linea aspera of the femur. So next point is common function. The primary functions of medial compartment muscle is adduction of the thigh. They also assist in flexion of the thigh, rotation of the thigh, stabilization of the thigh. But remember, adduction of the thigh is done by medial compartment of the thigh. Then nerve supply. Nerve supply, most muscles of the medial compartment are supplied by the obturator nerve. Exceptions is for two muscles, that is pectineus and hamstring part of the adductor magnus. Pectineus is supplied by the femoral nerve, whereas hamstring part of the adductor magnus supplied by the tibial division of the sciatic nerve. So most medial muscles get Now supply from the obturator nerve. Blood supply. The medial compartment muscles are mainly supplied by obturator artery and deep femoral artery. All the medial compartment of muscles. Then is some final memory sentences. Gracilis goes to the tibia. Adductors love the linea aspera and the obturator nerve rules the medial compartment. So this one sentence helps to summarize the entire medial compartment. Okay. So this is completes part 5 of our lower limb muscle series. So we completed our medial compartment of the thigh muscles. Now in the next video we'll discuss the muscles of posterior compartment of the thigh. That's also known as hamstring muscle. So thank you so much for watching this video. If you found it helpful, please like, share and subscribe to the channel. If you have any questions or doubt, feel free to leave them in the comment section in the below. Thank you for watching. I'll see you in the next video.